Good afternoon, and thank you for attending our webinar, Nuts and Bolts of School-Based Oral Health Delivery and Planning. We have a few housekeeping reminders before we get started today. If you are viewing as a group, please go to the chat window and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the chat box located in your GoToWebinar control window. We will address questions following the presentation. Attendees will be asked to complete evaluation poll questions at the end of the webinar. Please let us know how we're doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars. We expect that by the end of the webinar, you'll be able to understand different school-based oral health delivery and service models, identify opportunities for program partnerships to broaden oral health program outreach, understand how to minimize program staff and recipient risk through OSHA and infection control guidelines. Now I will introduce our presenters. First we have Ms. Terry Chandler. Terry Chandler began her dental career as a dental assistant in 1984. Receiving a certificate of expanded function dental auxiliary from Case Western Reserve in Cleveland, Ohio. In 1999, she graduated from the College of Southern Nevada's Dental Hygiene Program, receiving the prestigious awards of Leadership, Sigma Phi Alpha, All-State Academic, and Community Oral Health. Her role in public health began during her coalition work on a successful legislative campaign to support community water fluoridation, establishing Clark County, Las Vegas, Nevada, as the first county in Nevada to have a fluoridated public water supply. Most recently, she has dedicated all of her efforts as the founder, CEO, Executive Director of Future Smiles, a Nevada nonprofit school-based oral health program that addresses the unmet oral health needs at-risk children. Her greatest reward stems from knowing that her program has served more than 11,000 children, more than 20,000 teeth to receive a dental sealant. Our second presenter is Ms. Jeanette Atkins. Jeanette Atkins is the Safety Operations Director for Healthcare Safety Partners. In 2011, she became a master-level certified healthcare safety professional. She has spent the majority of the last 10 years in the field working hands-on on the medical dental practices, finding and establishing practical solutions to compliance with the current OSHA regulations and CDC guidelines. In addition to completing site surveys, trainings, and regulatory inspections, she has played a vital role in the development and implementation of current processes and programs within the organization. She is known to bring fun and excitement to what is normally another boring training. And without further delay, I will turn it over to our first presenter, Terry Chandler.
Good afternoon, everyone. It's a real honor to be here with you today, and I'd like to thank the Alliance for giving us this opportunity to share some insight into how an oral health program can impact your community. I'd also like to thank my colleague Jeanette Atkins from Compliance Alliance for joining us today. After 30 years, I can tell you that I still love teeth and I still love healthy smiles. These are our learning objectives. Dental hygienists specialize in prevention. Dental disease is caused by bacteria that likes a warm, wet, dark place to grow. Its sole mission in life is to survive, metabolize a carbohydrate, and release acid. As dental professionals, we can all attest that sealants can protect teeth from that bacterial acid. These two pictures tell the total story, disease versus health. In fact, CDC research found that 81% of teeth that receive a dental sealant will avert tooth decay for the first 2 years, and then they will continue to protect that tooth for 5 more years. I ask, what if preventive care, like a dental sealant, were as institutionalized as vaccines? Could we move the oral health meter in a positive direction? I'd like to think so, but this is going to take policy change and awareness. When we look at the national findings, 23% of children ages 2 to 11 have one or more primary teeth with untreated decay. 20% of kids 12 to 19 have a permanent tooth with untreated decay. And by the age of 15, our young people, 60% of them have experienced untreated decay. The cost of dental disease is outstanding. In 2009, it's been reported that children ages 5 to 7, that $20 billion was spent on dental treatment. 40% of that cost was spent out of pocket, and 51.7 million hours of school are lost due to a dental health issue. Recently, in a proclamation released by President Barack Obama during our National Public Health Week, he stated, "We are shifting the focus of our country's healthcare system from sickness and disease to wellness and prevention. We need to find solutions that address dental disease prevention, finding cost-effective ways to reinvest in prevention. That $20 billion that was reportedly spent on dental disease repair could go much further if it was invested in a preventive care system." And these are some kids from our Brush at Lunch program at one of our schools. If we all could institutionalize the idea that you brush after you have meals and that it can be part of the school setting, we may make a difference in dental literacy in our country. There are 3 primary school dental operational models. We have the CareMobile, which is a vehicle that will drive in and out of a school property, school-based health centers, which are brick and mortar, and then portable dental units, which can be carried in and carried out of a school setting. This is a CareMobile. Everything is contained inside this vehicle. They typically have between 2 or 3 operatories, and they're a wonderful PR marketing piece. There usually is a capital investment. They are expensive to purchase in the beginning. There are long-term maintenance issues, and things that we've found is that they are climate sensitive. They don't like it when it's really hot, and they don't like it when it's really cold. When I began Future Smiles, I didn't have the option of a CareMobile. What I did have, though, was a school-based health center that had a set dental operatory. This is Cunningham Elementary on the lower left side. This dental treatment room had not been used, so I kind of came up with the idea of using it for a dental hygiene-based program. We wanted to have our own kind of identity for that program, so we named it an EPOD, which stands for Education and Prevention of Oral Disease. Today we have 2 EPODs in school-based health centers, but then we also have this modular building that was donated to us by the City of Las Vegas, and this building has 2 dental operatories. It has a full sterilization area, has an administrative area for our administrative support team, where we have our internal server, which we have for Dentrix, which is our electronic health system. So every single site that we use, we can Wi-Fi access that server to use Dentrix for electronic health records and e-billing for Medicaid claims. So that's a huge building, and it is very helpful for us to be able to provide a full comprehensive program throughout Southern Nevada. We also have 2 schools that have an EPOD in a classroom. So there's different ways you can use different existing resources to be able to implement a program. We also have a sealant program, so we have Future Smiles Mobile. We typically like to bring 2 portable chairs, 2 dental hygienists, and a dental assistant into the school setting. We can use a classroom. This particular setup is in a computer lab. This is what it looks like when you pack it all up and you put it in your car. There's a compressor here, a chair, a light, all of the supplies and everything. And this can fit into most SUVs. So we, as a team, transport the equipment to and from different schools for the sealant program. There are 3 main dental delivery systems. You have a basic system, which will provide basic services for screenings, oral health education, brush at lunch programs. You can distribute oral health supplies, maybe even provide a fluoride varnish program. You also have a dental hygiene model, which would be dental disease prevention, dental hygiene services from sealants, fluorides, prophies. We also encourage case management, where you're referring the students to a dental home for restorative dental treatment, because you're there on property providing that triage and that assessment, so you know who needs that restorative care. Full dental care programs have restorative treatments that they provide on school campuses. Ideal partners. You want to look at who you would want to partner. If you're going to go into the school setting, you have to talk with the school district and create a relationship with the school district, the school administration, the principals, and the teachers. Other partners could be school-based health centers, school-linked programs, health district, homeless shelters. I also encourage you to have a relationship with the dental school and the dental hygiene programs in your community, and of course the professional dental and dental hygienist associations. Things to ask yourself when you're coming up with a program design. Who will you serve? What services will be offered? Why are these services important? What kind of data are you collecting? How and when will the services be offered? And you need to come up with a criteria for schools, because what will happen is as other schools find out about your program, they will ask you, can you come to our school? So you really need a distinct guideline on what schools you'll serve, what the free and reduced lunch enrollment will look like, Title I schools, what have you, so that you can have a very comprehensive focused mission. This is a funding chart that I like. It really gives you an idea of the different partners. And sometimes partners may not necessarily be providing funding, but they are opening doors, creating relationships, coming up with other ways to help an oral health program grow and expand. You want to look at best practice models. You want to establish funding relationships because it requires supplies and people and a lot of costs that are incurred with having an oral health component in the school. You want to look at data collection. You need an MOU and an agreement for risk management with the school district or other partners. Do you need insurance that covers risk management and liability? Business licenses. Also, establish goals and do this early on. You need to have weekly, monthly, and annual goals for your program so that it keeps you on track. Other resources that we found, Future Smiles has been really blessed by a relationship with Oral Health America and their Smiles Across America program. We receive product donation through this program. We've received grants and other support pieces for our delivery with our oral health program in the school setting. Your staff is going to have to maintain the portable dental units if you're using dental equipment, so they need to be trained. Portable dental units are very different than what we have in a traditional dental office setting. So I encourage you to have regular staff meetings where they go over how to care for the equipment, how to assemble it, how to put it back together. We have protocol manuals that showing pictures with how everything goes back into the bins and the different containers that we have. We like the DentalWorks equipment because of the way it packs up and is utilized. We've also discovered this tile flooring. This comes from a garage flooring company actually, and it's a hard surface. They all snap together, and it gives us a flooring protection for the school. Lots of classrooms have a low carpet that is inside those classrooms, and we need to protect that carpet from the aerosols that we create with our sealant program. It's really important to be mindful that when you leave a classroom, you need to return it back to a classroom setting so that it is disinfected and healthy for the students. This is another equipment piece that we've discovered. It's called a Stericyl straw. It's made from a silver citrate infused resin beads that are encased in a tubing cartridge. The delivery system is composed of 17.5% silver and 82.5% of a weak acid cation exchange resin and water system. It's non-toxic, non-irritating granular product that exhibits a hazardous material identification rating of 1 for health, 1 for flammability, and 0 for reactivity. All water is delivered through the unit via the straw. After initial shock treatment, a continuous flow of Stericyl antimicrobial ion-based component is supplied in the tubing over an extended period of time, assisting with the resistance of bacterial growth in both the tubing and the bottle. The Stericyl straw is formulated to be continuously present in dental unit water system, and the company recommends that you use distilled water or deionized water. We use distilled water. That's what that big jug was in that original picture that showed with the trolley. To understand water testing and purity, we need to look at CFUs, which are colony-forming units. This is the unit used to determine the viable bacteria and fungal cells in a sample. And we also need to look at HPCs, which is the heterotrophic plate count. This is the bacterial count in the water. The FDA-cleared and EPA-registered Stericyl straw with a purity of 50 times below guidelines established by the ADA and the CDC. It's used for a whole year, so this thing will last for 365 days. To my knowledge, it's the only product that actually is incorporating an automatic shock treatment when you initially install it so that you can have optimum control of bacteria. It works with any bottle. They recommend that you use a bio-free bottle. It eliminates the need to empty the water out of the bottles at night or to purge the lines because it stays inside the water bottle and it continuously fights the bacterial growth. No tools are required to install it. You wear gloves when you do place it, and it is, again, FDA cleared. The unexpected. As a public health program, the one thing that we can count on is the unexpected. Sometimes you just kind of need to roll with it. Last year, Future Smiles was given a room at a local school-based health center. The health center building was about 8 years old. The use of the room in the health center allowed us to establish an EPOD. This was really great because previously we've been going to the school with the sealant program. So for program, we were really excited to have this set EPOD setting in the school-based health center. After a few months, Jen, our public health dental hygienist, she wanted to rearrange the room to make it more ergonomic and create more space. She pulled away this large filing cabinet that was against the wall underneath this window over here, and she immediately discovered black mold was growing on the wall behind the filing cabinet. This was our first experience with something like this, and we immediately contacted Compliance Alliance and asked Tracy and Jeanette, what do we do? In 2004, the Institute of Medicine found that there was a significant evidence to link indoor exposure to mold with upper respiratory tract symptoms, coughing, and wheezing in otherwise healthy people. It stimulates asthma symptoms in people with asthma and hypersensitivity pneumonitis in individuals susceptible to that immune-mediated condition. So this wasn't good, and we needed to figure it out. Since the school-based health center is owned by the Clark County School District, the district needed to address the mold. The health center was closed for a month to allow a mold specialty company to come in, resolve the mold issue, and disinfect our equipment in the room. The district moved really quickly to resolve the issue, and it fostered a healthy environment for the health center. Some other things that we've encountered pertain to the fact that school-based health centers are not typically part of the school. They're in a separate brick-and-mortar building. So the healthcare staff has to be mindful of many things. They have to remove trash. They have to look at care and maintenance in the building. And if they're not going to be able to do it, they need to find workers that will. They need to observe the grounds around the school-based health centers and make sure they're maintained. Are there any big trees that need limbs cut? Is there any debris on the sidewalk as your patients come into the building? Will that debris be a hazard for them? Another concern is food being left in the building. We have had issues with ants, bugs, and even scorpions. All of these issues ended up requiring pest control services. So keep an eye out for what's going on within the whole health center, not just your operatory or your room. Don't panic, call an expert. And I was really grateful to have Compliance Alliance to help us out with this. Future Smiles, to date, we have 5 of our EPODs, and we bring the sealant program to an additional 18 schools. These are some of our program outreach numbers since inception. I think for me what I'm most proud of is that we've placed 25,719 dental sealants on children in the Clark County School District. And if you look at the CDC percentage, 81% of those teeth will avert tooth decay. I have a quote for you from Conrad Hilton. Achievement seems to be connected with action. Successful men and women keep moving. They may make mistakes, but they don't quit. So when you form your program, continue on with the mission because you're really doing the right thing for your community. Tiara, I believe that you have a poll question for our audience.
I do. Just one moment, please.
All righty.
All right, everyone, here is our poll question. Now, before the second portion of our presentation, if you could just answer the following question that is on your screen. Does your school district have an oral health program, yes or no? We give you 15 seconds. About 5 more seconds. Okay, great. It appears that 70% or 69% of attendees have an oral health program. Thank you, everyone. Now we'll turn it over to our next presenter, Jeanette Atkins.
Hello, everybody. Let me get my screen up here. All right, and I don't get to talk as much fun stuff as Terry did. I get to talk some rules and regulations. So this is going to be pretty brief. You definitely may have questions after this. So we're going to talk about OSHA infection control as it would apply to your facilities. So if you're not familiar with OSHA, they were founded in 1970 on a federal level, and their primary focus is to help prevent work-related injuries and illnesses by not just issuing standards, but also enforcing those standards. The big difference between OSHA and everybody else out there is OSHA is only concerned with the employee-employer relationship. So they don't care how you guys treat your patients. There are plenty of other people out there that do care about that. OSHA is just not the group. I know a lot of facilities may have volunteers that are volunteering and not necessarily employees of the company. So on a federal standard, volunteers are not covered under the OSHA standards. However, state plans, if you're in a state plan state, they can adopt volunteers into their regulations, and there are always other regulatory agencies you may need to look into to see if your volunteers are covered by any additional standards. There are state and federal OSHA. The big difference is that those state plans run within your state, and they have to be at least as effective as the federal standard. So federal OSHA applies to everybody. Certain states, as you can see on the screen, the blue ones have state-run programs. You can actually be hit by both federal and state OSHA in those facilities. Rarely see it, but know that it can happen. One of the big clauses that OSHA will use if they come into your office to cite you for additional things would be their general duty clause. This is the clause that says all employers are required to furnish its employees with an employment and a place of employment that's free from recognized hazards and hazards that are likely or could cause death or serious physical harm. So how do you know if it's a recognized hazard? These are recognized items that you have recognized within yourself, within your facility, recognition by the industry in which you work, and last is common sense. We'd like to think that most people come with that, but that is an additional standard that they look at. For last year, these were the top 10 cited standards for the dental community when it comes to OSHA. So your bloodborne pathogen standard is always the #1, and we're going to talk about that, but you can see that it's not just listed to those bloodborne pathogen standards. As Terry stated, there are additional items that you have to take care of that might be building and maintenance. Walking, working surfaces could be trip hazards within your facility, and we're going to talk about all of those. So once a year, you need to perform a hazard assessment. This is a once-a-year thing. It's your wall-to-wall, floor-to-ceiling inspection that is going to show whether or not you're current with the OSHA standards that are out there. Whoever is doing that assessment has to write a statement saying, I certify on this day that I completed this assessment. They are also going to sign off on it. There is no qualification of this person, but they do need to be knowledgeable in the subject matter that they're looking at. You have to be knowledgeable of the OSHA items that they need to be searching for. This hazard assessment needs to be site-specific. With Terry's organization, they travel around, they move around, and we do have to go out to those different facilities to see if there are any additional hazards in those classrooms, in those EPODs that they're dealing with. We have additional mobile offices that we deal with where we have to go and check out their mobile van. You must establish safety objectives. What are you trying to go? Less trips, less injuries, less needle sticks, keep the numbers as they were last year. You have to establish goals, and you're going to update your programs to reflect those hazards that you identified. You give it a priority list to that hazard assessment to give you a due date and timeline, and you're going to update that until all items are completed. Once that annual hazard assessment is done, that doesn't mean that you're free and clear. Now you get to do routine assessments. These are usually your monthly assessments so that you can identify hazards as they arise. You need to check the equipment within your facilities. Even if it is maintained by the school, it is still your job to provide your employees with a safe working environment. So checking your fire extinguishers, checking your exit pathways, checking those exit signs, eye wash station, electrical, water damage, such as in the case of the mold. You're looking for all of these items on a routine basis so that you can identify those hazards as they arise. Some of the written programs that you must have within your facility, again, they are site specific, so some of this you may not have. One of the big programs most of you will be dealing with is your bloodborne pathogens program. Within this program, you have to determine who is exposed to these bloodborne pathogens. Most of the time it is going to be your hygienists, your front office staff, not necessarily unless they help with sterilization or cleaning your rooms. How do you handle contaminated linens, be it towels, cover gowns? What do you do with your regulated waste? How often are they picked up? You do have to look at transport of that regulated waste. If you are a mobile unit or you're working out of a school-based setting, how do you get it to that final destination? Safer medical devices. The Needle Stick Safety and Prevention Act came out in 2001, so if you are doing any kind of injections, you do have to look at safety needles. The hepatitis B vaccination is one of the largest items that OSHA will cite for. If you do not have documentation of either receiving that injection or declination from those staff members about hepatitis B. And then how are you going to manage an exposure incident? What are your step-by-step instructions? Where do they go? Who do they need to tell? And you go on from there. Another large program that has recently changed with OSHA is your hazard communication standard. This is the standard most of us may be familiar with, material safety data sheets, which are now termed safety data sheets. Hazardous chemicals, labeling your containers. You have to have written programs that are specific to that standard. Personal protective equipment, what do you provide to your office? How are they supposed to use it? These are all written programs you have to have outlined. Respiratory protection. How are your staff exposed to airborne diseases? What hazardous chemicals might you be dealing with? The mold issue that we dealt with, you have to look at all those kind of things, and how are you going to identify and take care of those problems? They don't have to be in-depth every single one, but if you don't know what to do, we're going to contact a mold remediation company, something like that. If you are fortunate and have radiation within your facility, what's your policies for that? Written policies and procedures. If you don't do radiation within your facility, you don't have to have a program for it. Emergency action plan. Your school most likely already has an action plan in place. So you can adopt their plan, but you can't just say, we're going to do what they say. You have to have a written version of their plan as well. Active shooting events. What is your staff going to be trained to do? Are they incorporated with that school training? What do you do for that kind of stuff? Natural disasters, depending on where you are in the country. What happens, if there's a tornado or a flood or a fire? What are you going to do within that school environment? Basic ladder safety. Laser safety, again, if you have that within your facility, you have to have written documentation of how you're going to manage that, what personal protective equipment is available. Lockout tagout is the management of hazardous energy, so your staff is trained on how to work with equipment that has potentially hazardous energy. Guards that come with equipment, not just lab equipment, but additional machines. Even a paper shredder comes with a guard. What is your staff going to do with those items? And your injury and illness prevention program is currently a state-specific program, so depending on your state, you may have to have this program. And this is the all-encompassing one that covers everything within the facility. Again, this is currently state-based. They have talked about making it a federal requirement, but that has not passed at this point in time. Now, in addition to the OSHA requirements, you have written infection control program requirements. They all have to be reviewed at least annually. So just because you have a book on a shelf, if you haven't looked at it every single year and signed off on it every single year, you are not in compliance. So you have to look at that to determine how things change, how regulations change. What can you do within your facility to reduce chances of exposure when it comes to infection control? Most states have adopted two major guidelines. Now, believe me, there are plenty more than what I could fit on this screen, but these are two very big ones. If you have not reviewed, I would highly recommend reviewing both of these documents because they have a lot of the guidelines that your states have already adopted and implemented within your facilities. You must do a risk assessment when it comes with infection control. So majority of the time when you talk OSHA, it's just the back office people, but your front office people, your administration office, if they have patients who are coming in, they breathe, and kids bring cooties with them, so they're exposed to not just the airborne cold and flu, but measles was a big issue that came out. If you have other outbreaks within your area, how are you going to identify those? What is going to be your protocol if you do come into an outbreak of some certain diseases? CDC does have a very nice document out there for work restrictions that you can use that as a guideline to help you write your own policies. Within your written infection control program, you have to go through those exposure risks. You have to talk your prevention strategies and your policies for your infection control procedures. You must run through your sterilization process. What is your flow? Do you have a sterilizer? Are you using cold sterile? What kind of packaging? Do you have cassettes? Do you have pouches? Your spore testing, is it in-house? Is it out-of-house? You have to have all of that stuff defined within those written programs. Your injury management, again, if somebody gets injured at work, it must be part of that written infection control program. Facility maintenance. When it comes to infection control, you're talking housekeeping. How often are those areas cleaned? What are they cleaned with? There are CDC guidelines for environmental disinfection for healthcare areas. So what is being done on that? And you have to have that written program for that. And you want to make sure that the staff of the school are aware of those requirements. If your janitor is cleaning, is he cleaning with the right equipment, or is that an area you take care of? Work area restrictions come into the employee. If the employee is sick, when will we let them come into work? You know, if they've got the sniffles, okay, maybe, but if they're running a fever, no, we're not going to let them, because we don't need to spread any disease from us to our patients either. Injury management, this is one of the big items you have to make sure that you have defined. Injury management is always immediately available and free of charge to the employee. These are work-related injuries that usually fall into your workers' comp insurance. You do want to run it through your workers' comp, because if you decide to try to take it on your own, you may be paying a lot more in the future if they do come back positive. Know where to send your staff if there's an injury. Again, based upon your location, what's going to be the closest treatment facility? Your state and your work comp will have specific reporting paperwork. In addition, OSHA has a 301, which is their incident reporting form, and you may already be familiar with an OSHA 300 or OSHA 300 Sharps. In most areas, a dental office is exempt from keeping that OSHA 300 form, and not a lot of people know that. Now, you can still be state required to keep that, so you may have to check with your state plans. There are still some that require it. Certain injuries have to be reported to OSHA. So if somebody dies on the job, no matter if it was a heart attack or work-related, if they die while at work, it has to be reported. If an employee spends overnight in the hospital, if somebody loses a limb or loses an eye, those have to be reported to OSHA, and they are going to come out and see you guys. Training. Training is free of charge. It must be provided during work hours. They must be trained about what they're being exposed to prior to occupational exposure. You are going to train them again if their tasks or job duties change. If you notice they're not doing something right, we're going to have to retrain them one more time. And then annually thereafter. OSHA bloodborne pathogens training is 365 days from their last one. So just because you had it last March doesn't necessarily mean next March is accurate. It is 365. It must be site specific, and it must be interactive. A lot of offices will use videos that they purchased online. You must be able to ask the trainer questions. So unless there is a way to access that trainer, those videos do not count. The person who does training, if you do it within your facility, there are guidelines to say whether or not you're qualified to do that training. In addition, the training records and the training outlines, OSHA has specific documents which have to be included, specific setup, signature, job titles, dates, qualifications of the trainer, all have to be on those outlines. What is regulated waste within your facility? Not everything with blood on it has to go in there. It's blood or other potentially infectious material that is liquid or semi-liquid. If it releases contents when compressed, if it's caked on, dried on, contaminated sharps, and last are people's parts. So pretty much if it's soaking, sopping, dripping, pokey, oozy, juicy, gooey stuff, that's regulated waste. Now your facility or your school may ask that you take that gloves and the gauze and stuff with you, but it's not necessarily regulated waste, and that will save you a lot of money because a lot of people will throw away stuff that doesn't qualify and pay extra for that. Your sharps containers, there are mounting guidelines based upon if your staff member is seated or standing. When they're working with a sharps container, you may think you want them high so that the students can't get their fingers in there, but if it's too high, the staff members can't see if something's poking back out at them. They need to be secured so somebody doesn't kick it and it goes flying and you have sharps all over the place. And then your disposal. You may have a pickup service that comes to the school or to your facility to pick it up. You may be able to treat it within your office where you add a solution to it, it hardens, heats it up, and you can throw it away with regular trash, and there are mail-back systems. Now, I will tell you, in my county, I am not allowed to do the treated one, but the county next door, they can. So you do have to look at your county and state regulations when you're dealing with some of this. Immunizations for your staff, you need to have documentation that your staff have their vaccines. It may seem silly, but especially again with the whole measles outbreak, or if you're exposed to chickenpox, you need to know which staff members have had those vaccines, because if there is an exposure, you need to know how to manage that exposure. Your infection control evaluation, a couple things you want to look at is how do you transport those instruments, be it clean instruments or dirty instruments. If they are dirty, they need to be labeled, and there are certain Department of Transportation, state and county regulations if you're transporting biohazard or dirty instruments that you may need to look into. If you're keeping your equipment in-house, if there's access and the kids could come in there, you may want to lock those up so that there's no accidental exposure. Even if your instruments are clean, believe you me, it's not going to be something fun to go through. Sterilization processes. Are you using your solutions correctly? Are your staff closing the packaging? Are your spore tests being done correctly with instruments on a consistent basis? And are you truly disposing of those single-use only items? Your staff member may be trying to save you a little bit of money, but in the long run, they could hurt you. So make sure that you have gone through all of that with your staff. If you have carpeting, as Terry said, a lot of these schools are low-pile carpet. You don't need to have carpet underneath those chairs. So it may be something where you have to purchase a flooring that can travel with you, or having an area that has tile or hard floors. When you look at disinfection of instruments, low or intermediate level disinfection are items that say they have Hep B or TB claim. For patient carrier areas, you have to use something that kills Hep B. It is also used on any non-critical items and your clinical contact surfaces. So for any of that, you're talking your cabicides of the world where you spray wipe spray, your BioSurf, SaniCloth, there's tons of them out there. High-level disinfection was commonly known as cold sterilization. Are your heat-sensitive semi-critical items, so anything that goes into the mouth but cannot be sterilized, you can cold sterile it. However, if it can go through an autoclave, you need to sterilize it. So if it's heat-tolerant, semi-critical, or critical items, those must go through a sterilization process. Your sterilization area, depending on where it is, sometimes it's a challenge because you're working in a room that's about 3 by 5 and you have about 1 foot of space for your sterilization area. So you have to think about how are you going to keep the dirty and the clean separate. You should always have a flow that goes from the dirtiest to the cleanest, and it may not be a gigantic area, but keeping that flow so that there's no cross-contamination and that your staff knows, or anybody else who comes in there knows that that is your dirty area. So this is one of the e-pods that Terry works out of, and they go from their dirty side to their clean side. And it is set, people have signs up, you know which areas those might be. Your spore test on your equipment, even if you're having somebody else sterilize your equipment for you, if somebody's volunteering to do that, you do need to have results of those spore tests. Don't just hope that they're really doing it. You want to have documentation for every sterilizer. If you're a larger facility, you have multiple sterilizers, God bless you, make sure you're doing weekly spore tests. They should be run with instruments, never in an empty load. If you have a failure is 2 failed spore tests, then you would need to have 3 passes before you can use that machine again. The last thing I have to talk about are your dental water lines, and Terry touched on this with her Sterisil straw. With your dental unit water lines, you have to manage these lines. There are treatment, there's the straw, there's tablets. You have to do something to your lines to make sure that you are going to pass your water line test. There's the straw, like she said, you attach it, it's good for about a year, it has the shock in it. These tablets, they have different colored, like the shock tablet is yellow versus the treatment tablet is blue, so your staff knows the difference. You must follow the instructions when it comes to the manufacturer on these. Some of them will say you need to shock your lines once a month. Some of them are once a quarter. Some of them say don't ever shock. But you need to make sure you're following your manufacturer's instructions on those. And then you need to test. There are 2 ways to test. There's in-house little Petri dish kind of tests, and then there's mail-off test tubes. Please remember that we are not testing for the hardness of the water. I do have offices that come back with mineral counts versus biofilm counts, so we do need to make sure we're testing for the correct items. There are state guidelines. Overall, when you talk CDC, they don't have a specific, you have to test frequency. You have to stay below 500 CFU. Now, I will tell you certain chair manufacturers may give you a different number. For example, ADEC says you need to stay under 200 CFUs. So please again, you have to follow those manufacturers' guidelines. Some states, it's once a year. Some of the more stringent ones I've seen have been to do it for 3 months in a row, and then you do it quarterly. So again, check with your manufacturers on your frequency of this to make sure that you are meeting those guidelines, because if you're not, unfortunately, those systems will hold the biofilm in there and can be released into that patient's mouth. And our job is not to give our patients anything. We're definitely trying to keep everything out of their mouth possible to keep them as healthy as possible. So in general, that's the quick, brief overview that I have for this. So Tiara, the last part I have are those questions.
Thank you so much, Terry and Jeanette, for the excellent presentation. Before we ask Jeanette and Terry any questions, we would like to ask you, our attendees, a question. To further assist you, do you want more information on online OSHA and infection control courses? Please answer yes or no. Okay, 15 seconds. Thank you, everyone. At this point, we will ask attendees if they have any questions for Terry or Jeanette. To ask a question, please go to the chat box located in your GoToWebinar control window and type in your questions. While we give everyone a moment to enter their questions for the presenters, we would like to highlight a few items, such as our exciting news of DentalQuest Foundation funded School-Based Health Alliance grant that will support the innovation in school-based oral health services, learning collaborative, network projects. The 3 objectives will include assess the capacity and readiness of the 10 school districts to engage in a collaborative, bring together an expert to provide their expertise to learn in collaborative, establish a framework and curriculum for the best practices. If you need further information, please contact Donna Behrens, our project advisor, or Kate Schechter, program associate. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. Please join us. We offer 2 options for membership, individual or organizational. Organizational memberships are $500 a year, included discounts on professional services and products, letters of support for grants, newsletters, and more. Individual memberships are $100 a year. To learn more and to become a member, visit our website, www.sbhforall.org, or call Larry Boston. Okay, now we're going to open up the question box to see who has any questions. Our first question is, what was the name of the mat that you used to protect the carpets from aerosol?
It's made by a garage tile company, and their web link is in the PowerPoint. So I don't know if we could go back to it so you could grab it really quickly. Can we do that, Tira? Oh, you know what? I would do that. Hang on.
It'll be up on the website for them, too. It'll be up on the website for them, too, so if they want to refer back that way. And we'll also include the slide.
Okay, cool.
Okay, our next one is, this person works for a dental insurance company. Let's see, I'm sorry. So when using the sterile straw, do you still have to do a test for the water lines, and how often?
Janet, I'm going to let you chime into this after me, but we do it once a year. Initially, we did several water testings to make sure that the water lines were testing well. Previously, we had failed our water testing, and we were using a traditional shock and drop system. So once we started switching over to the Steri-Seal straw, all of our water testing came out fine. Are there some specific guidelines on your end, Jeanette?
The guidelines are going to be state-driven. So depending on which state you're calling from, I would check with your local board to see what their guidelines are, and or the manufacturer of your unit itself. A lot of time, the manufacturers of your water line system in your chair will say they must be tested X amount of time. Couples that come to mind, a lot of states might be once a year you have to test. If you have an ADIC system, they say you have to test once a month. So again, I'd recommend going back to your state or back to your manufacturer to see exactly what they're asking you for.
Okay, thank you. And we have actually one more question. Does your program help to enroll, Terry, children with insurance?
The mission of Future Smiles as a nonprofit is to provide services for children who don't have access to care. So we typically see children who are in the Medicaid system or they're uninsured. There is an income level that the families have to be below a certain income level to be part of the program. Every once in a while there might be a child that has an insurance product and their family cannot afford the copay or the payer part on the family side. So we have helped those children, but then we also try to help them with resources in the community to find a dental provider that will work with them. There's been a few families that were in that situation where we actually found a dental home for them and told the dental provider, you know, they don't have the copay and this child is in really bad shape. The case I'm thinking of was a rampant pediatric caries case, and that dental provider said, you know what, I'll work with the families and I'll get this kid out of pain and getting them the right care.
Okay, thank you. We actually had another question that comes through. Our state provides a dental sealant program. Do we need a hazard assessment for each site?
Yes, so your hazard assessment is going to apply to all areas that they work. So for each location that you're sending your employees to, you do need to make sure that it's a safe work environment. So yes, you would need to do one for each facility and each location.
Hey Jeanette, it's Terry. I'm also thinking that for the sealant programs, that would be like our mobile program. Do they need to have each school site assessed, or could they just go to the school sites for the mobile program that they're at the time when you do the annual inspections?
You can go at the annual time, and another way that we look at those, especially with your facility, Terry, is we give you those inspections to do as you guys are out there. So some of your staff members are doing those assessments when they go out there to look and see. A lot of times you're dealing with just one room, and it may be a 20 by 20 room that they're doing a quicker assessment on, but you would need to look and make sure that your staff is still in a safe environment no matter where they are.
Oh, and you know what? One other thing that we have done is we have a monthly calendar because the mobile program, it keeps moving to different schools. And in the monthly calendar, we identify at the end of the month each site that the staff is supposed to do their OSHA walkthrough and do their inspections. And then they sign off on a sign-off sheet. I've checked this, I've checked the lights, I've checked other things, so that we have documentation that that has been done by staff.
Correct. Yep.
Okay, thank you so much, Terry and Jeanette. We truly appreciate your time.
Thank you for having us.
No, thank you for having us. Everyone have a good day.
Thank you. You too. We want to also, before we finish, we want to remind everyone that this has been recorded and will be uploaded to our site within 3 to 5 business days. We also have a few poll questions that we would like for you to please answer. First, Does this presentation meet your needs or no? Five more seconds. How well did the presentation meet the stated objectives? We'll give you about 20 seconds. Three more seconds. How likely are you to apply information from this presentation in your organization? Give you 15 seconds. A few more seconds. Would you recommend this webinar to others? Yes or no? We'll give you 15 seconds. Thank you, everyone. We appreciate you taking time out to attend our webinar today. If you have any additional questions, please contact us at info@sbhforall.org. Again, thank you for attending.